Welcome viewers to our deep dive into the world of ultrasonography.
Welcome everyone. If you've ever wondered how medical professionals can tell if a baby is a boy or a girl just by looking at an ultrasound, you're in the right place. By the end of this quick and insightful session, you'll not only be familiar with the key landmarks for determining a baby's sex but also gain the ability to recognize these important cues yourself. When can we determine the sex? Typically, the sex of the baby can be determined by ultrasound around the 17th to 20th week of pregnancy. However, in some cases, it can be identified as early as 14 weeks. Key structures in determining fetal sex in ultrasound imaging. Understanding how to identify the sex of a baby through ultrasound involves recognizing specific genital structures at different stages of pregnancy. Let's break down the process into two key phases: the early phase, 14 to 16 weeks, and the later phase, beyond 18 weeks. Early phase, 14 to 16 weeks. During the early stages, the genitalia are beginning to form, but they can often appear quite similar for both sexes, known as the genital tubercle. Here's how to navigate this. Around 14 weeks, the early development of the penis and scrotum in male fetuses may sometimes be visible on ultrasound. A crucial indicator used during this developmental stage is the angle of the genital tubercle relative to the lumbosacral skin line, which serves as a baseline for measurement. For male fetuses, if the genital tubercle protrudes at an angle greater than 30 degrees above the lumbosacral skin line, it is typically indicative of male genitalia. This means the tubercle points upward, deviating significantly from the baseline, which aligns with the expected anatomical development of a penis. Conversely, for female fetuses, the genital tubercle angle is less than 10 degrees relative to the lumbosacral skin line. This presents as the tubercle aligning more closely or parallel to the fetal body, suggesting the development of the labia and clitoris rather than protruding outward. It is important to note that there is a range of uncertainty between 10 and 30 degrees where the determination is considered indeterminate. In this range, the angle does not clearly support a definitive conclusion on whether the developing genitalia are male or female. This measurement provides a non-invasive means to predict fetal sex, although it is important to consider that absolute certainty cannot always be achieved, especially in the indeterminate range. Further development and possibly additional imaging at a later stage might be required to confirm the sex of the fetus with higher certainty. Later phase, beyond 18 weeks. As the fetus develops further, the genitalia become more distinct and easier to differentiate. For males, the genital anatomy becomes increasingly distinct as the pregnancy progresses. The penis is visualized as an elongated structure protruding from the fetal body, typically extending outward from the pubic area. It is well defined and maintains a consistent thickness, distinguishing it from the umbilical cord, which can sometimes be mistaken due to its location but is generally larger and less uniform in shape. The scrotal sac, which appears more defined over time, typically houses the testicles by around the 28th to 32nd weeks of gestation, when they descend. It is common to observe a small hydrocele during this period, manifesting as a fluid collection within the scrotal sac. This is considered a normal finding on ultrasound, aiding in confirming male genital anatomy and providing reassurance about the typical developmental processes occurring within the fetus. For females, the clitoris and labia are more developed. The labia can be seen surrounding the clitoris, forming the typical female genital structure. The labia appear as two symmetrical echogenic lines or mounds that frame a central hypoechoic, darker, area. These structures represent the labia majora, which are more prominent and easier to discern as the fetus grows.
Now, test your skills with our series of short quiz videos where you guess the baby's gender using ultrasound. Perfect your ability to accurately determine the baby's sex.
Dive into the captivating world of ultrasonography in just a few seconds. Hit subscribe and boost your ultrasonography expertise.